Hi, I'm Jacqueline Kiefer, DO. I am a primary care sports medicine physician for Community Health Network, as well as a head team physician for the University of Indianapolis and Warren Central High School. I'm here today to talk about pediatric sports-related concussions and what every parent should know. So what is a concussion? A concussion is a type of traumatic brain injury, or TBI. It's usually caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move quickly back and forth inside the skull. This fast movement can cause the brain to bounce around or twist, and that creates some chemical changes in the brain, and sometimes stretching and damaging the brain cells. It is often an injury to the way that the brain works, as opposed to a bleed or a bruise. If you think your child may have a concussion, they may complain of any one or more of the following symptoms. They may talk about headache or pressure in their head. They may have some nausea or vomiting, balance problems or dizziness, or even double or blurry vision. They can be bothered by light or noise. They may feel sluggish, hazy, foggy, groggy. They may have some confusion or concentration, and sometimes they even will have some memory problems. They a lot of times will just say to you, "I just don't feel right," or "I feel down." You might notice that they are forgetful, appear stunned or dazed. They may be clumsy or off balance, very tired, or even they don't remember what happened before or after the blow that they took. Most concussions respond well to conservative care with rest, both physical and mental. Encourage your child or teenager to rest, avoid bright lights, loud noises, looking at a phone, tablet, or computer screen for a long time, as well as to not return to a sport or activity until they are cleared by a provider that is experienced in concussion care. You really should try to avoid Tylenol and Motrin in the first 24 to 48 hours because it is important to know if the headache is getting worse. This is one of the warning signs to look out for. Other warning signs can be that if your child has one pupil that's larger than the other, they're excessively drowsy or have an inability to wake up, they're having a headache that gets worse and does not go away, if they're slurring their speech, they have weakness, numbness, or decreased coordination, or repeated vomiting or nausea, convulsions, or seizures, and that can sometimes be shaking or twitching. You also want to look out for any unusual behavior, increased confusion, restlessness or agitation, or even loss of consciousness. If a brief loss of consciousness occurs, it should be taken very seriously. Keep an eye on them. As long as they are resting, concussions usually improve over time. However, if they are getting worse quickly, you should immediately take your child to have them evaluated. As a parent, one of the most important things you can do is to encourage your child to speak up if they are not feeling right, or if they have a headache, or any of the other problems that I previously mentioned, especially after a hit to the head or the body. They only get one brain, and no game is more important than protecting it. Returning to play before a concussion is fully healed can lead to further concussion, brain swelling, and even death. In order to get back to school and sports safely, your child should be seen by a healthcare provider experienced with concussion care. This provider can provide good advice and guidance to aid in return to the classroom and eventually to the field of play. If concussions are treated promptly, they usually get better within a few weeks, sometimes faster. There's no set time after a concussion that they need to be out of play or out of school, but all concussed athletes should undergo the 6-step return to play protocol prior to returning to contact sports. If you are concerned about your child having suffered a sports-related concussion, reach out to your pediatrician, family medicine, or sports medicine provider to have them evaluated. Many schools also have certified athletic trainers who can help with this evaluation and referral process. And as I mentioned before, we only get one brain and we want that brain to last a lifetime. Prompt diagnosis of concussion, removal from play, and appropriate rest are key. For more information, reach out to your healthcare provider or review information available through the CDC's Heads Up program that has more information for parents and coaches.